Hi, everyone. It's the top of the hour, so we're going to get today's session started. Thanks so much to coming to Designing for Health Literacy, Exploring Emergent Intelligent Technologies to Support Older Adults' Health Information Access and Management. My name is Erica Lake, and I'm the Medical and Academic Library Outreach Coordinator for Region 6 of the Network of the National Library of Medicine, and I'll be your host for today's session. All right, we have just a couple housekeeping items to cover before we get started. All attendees are currently muted, but we do welcome your questions and comments in the chat at any time. Miles Dietz-Castell, Region 6's Communications and Finance Coordinator, is providing technical assistance today, and he'll be keeping an eye on the chat with me. So please be sure to select everyone from the drop-down menu when posting your questions to chat to ensure that both Miles and I see them. And we'll queue them up as they come in and save them for our speaker to address at the end of her presentation. Closed caption is enabled, and it's available by clicking on the icon with the 3 dots down there on the bottom and then selecting closed caption. We are recording today's session, and we'll post it on NNLM's YouTube channel in 1 to 2 weeks. And at that time, everyone who registered for this session will receive an email from us with the link for the recording. This class is eligible for 1 Medical Library Association continuing education credit, which you'll be able to claim through the evaluation link and the enrollment code that we share with you at the end of the session. And speaking of that evaluation, your feedback really matters to us and helps us improve future training. So please take a moment to complete that for us. Since some of you might be first-time attendees to one of our webinars, I'd like to share just a couple words about who we are. NLM is the National Library of Medicine, and it's one of the 27 institutes and offices of the National Institutes of Health. It's the world's largest biomedical library and produces online resources like PubMed and Medline Plus. NNLM, the network of the National Library of Medicine, is an outreach program of NLM, working to ensure health professionals and the public have equal access to health information. NNLM is made up of 7 regional medical libraries, 4 national centers, and 3 national offices, all providing training, funding, and engagement opportunities to over 9,000 NNLM member organizations. Region 6 includes the states of Iowa, Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. If you'd like to connect with your regional medical library or learn more about us, you can check out our website at nnlm.gov. Today's session was organized by Region 6 as part of our Speaker Spotlight series. This series features expert guest speakers presenting on topics of interest to all our users, which include librarians, public health practitioners, educators, clinicians, and others who work with health information. You can learn more about upcoming sessions by subscribing to our Region 6 newsletter, checking out our blog, or by following us on Facebook or Twitter. In fact, you can join us on Twitter right now if you'd like, because Miles will live tweet during this session and share highlights and links to information that's mentioned. All right, it's my great pleasure to introduce our speaker for today's Speaker Spotlight. Dr. Akeisha Martin-Hammond is an assistant professor of human-computing interaction in the School of Informatics and Computing at Indiana University, Purdue University, Indianapolis. Dr. Martin-Hammond earned a PhD in computer science from Clemson University, an MS in computer science from the University of Alabama, Birmingham, and a BS in computer science from Tougaloo College in Mississippi. She conducts research and teaches in human-computer interaction, where she examines the intersection of the areas of aging, health, and intelligent technology design. She employs user-centered and participatory design methodologies to investigate the design of existing and novel intelligent technologies, such as conversational assistants and artificially enabled tools, to support aging through improved access to health information and wellness resources at home and in the local community. More broadly, she investigates ways to enhance the usability and accessibility of technologies for older adults across the lifespan, and explores the benefits and barriers of adopting these technologies in home and community environments. Her work is funded by Google, the National Science Foundation, and the National Institutes of Health, and she is also a recipient of a National Science Foundation Career Award. So welcome, Dr. Martin Hammond, and I'm now going to turn off my camera and turn the session over to you.
Thank you so much. And thank you all for inviting me to speak. I'm very excited about sharing about this topic. And so let me, my slides. So today, thank you again for inviting me to speak to you all today. And today I want to talk a little bit about designing for health literacy. So a lot of the research that I do is with older adults and looking at different ways that technology can support them in managing and accessing health information in the home environment. And so that's what I want to share with you today. So I'll start by providing a definition of health literacy, what that means, and then I'll talk a little bit about older adults' experiences managing health information at home. And these are quotes and stories from research that we've been doing with older adults, where they share about their experiences trying to manage their health and their health information in the home environment. And then I'll move on to talking about emerging AI-enabled technologies that can support health information management in home. And I'll end by talking about some of the open challenges and opportunities we have in this space to further support older adults. So I like to start with a definition so everyone's on the same page on what do I mean by health literacy. So this is a definition from the Healthy People 2030, and it divides health literacy into two categories. There's personal health literacy, which is defined as the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. The other component of health literacy is defined as organizational health literacy, and this is the degree to which organizations can equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Now today, because my work primarily focuses on home-based and community-based environments, I'll be sharing more about ways and kind of experiences with personal health literacy for older adults. So I would like to start by sharing some of the feedback that we've gotten through several different studies where older adults have shared their experiences trying to find and manage and access health information in the home environment. And I'll primarily do that by kind of sharing quotes and then stories around those quotes that older adults have shared with us through the process of our research studies. So the concept kind of framing this work and kind of the reason why we are looking more deeply into not only older adults' experiences, but ways that technologies might support them is this concept of information work. And it's a concept that basically focuses on how more and more of our care is moving into the home environment. So we are taking a lot of care tasks home with us for ourselves and our caregivers. And the concept of information work kind of captures this idea is in that when we're managing our care at home, we're required to kind of organize and find a lot of information, whether that be managing medications or appointments or information about chronic illness, or whether that be kind of coordinating information from multiple doctors or from caregivers, whether that be formal caregivers such as doctors and nurses, or informal caregivers such as family and friend healthcare providers. And then we have information related to managing activities of daily living that we're just required to do to live healthier lives. And so a lot of this information work is moving into the home and it's putting more responsibilities on both the older adults and the caregivers. So with that, I want to share some of the experiences that older adults have shared with us through our research studies about what this means and the barriers they face in doing this in the home environment. So I want to talk about 6 here. There are probably more than this, but these are 6 that kind of we see recurring in our research on barriers to actually managing health information at home. So accessibility, recalling information, understanding diagnosis and medical terminology, and then finding trustworthy and credible information, technology skills and usability, and access and infrastructural barriers. And I'll share experience of what older adults have told us through our research studies. So I'll start with accessibility barriers. So one of the barriers we see that when we talk to older adults about their experiences managing health information at home for different reasons is this idea of accessibility barriers. So accessibility, as we age, we tend to have changing abilities. So we might not see as well or hear as well. And some older adults have disabilities, whether it be a vision disability or a hearing disability. And this can make accessing information at home challenging. So this is a quote from one of our participants where we were looking at a note-taking application that could help older adults manage communications with their doctors. So in the study, we found it was very important for older adults to be able to kind of take the information from their healthcare providers. They play an essential role in their care, even at home, and be able to take that information and come back and kind of reflect on it so that they can know what to do once they're in the home environment. So one of the challenges this older adult was facing, this was one of our participants, they were sharing with us about how they go to a doctor's visit, but they have a hearing problem, what they call a hearing problem. So to kind of compensate for that, they would invite their daughter, who acts as a caregiver, along to help kind of understand and be able to hear what the doctor is saying, and also working with the doctor to be able to make sure they're getting all of the information. So the quote says, "Everything goes well in the doctor's visit, except my hearing problem. However, sometimes she knows I can't hear well, and so my daughter asks him to repeat it, or later she tells me what he said." And so this is just one example of an accessibility barrier that some older adults face as they are trying to gather information to help them make informed decisions about their health. And we see similar stories such as this one for older adults who have vision impairments or having trouble seeing different information, of being able to get the information from their doctor's visit and bring it home and be able to refer to it later. So kind of related to that is this idea of being able to recall information. This study we did with a group of older adults with chronic illnesses that were managing several different chronic illnesses. They may be visiting 3 or more doctors per year. And so they shared that, again, this note, being able to take notes and refer to information once they get home was a bit challenging for them. And so trying to manage all the paper notes that they were taking and then accessing their personal health record was something that kind of was a barrier to being able to refer and recall information. So in this study, we talked with older adults that shared that trying to remember everything in sequence. So they felt like it was important to understand the sequence in which the healthcare providers gave them the information, especially around their medication information. if there's some type of change is a challenge. So they say trying to remember everything in sequence, especially in medication, if there's a change, I try to remember what the doctor said, but it is difficult. So another barrier to managing health information at home that we have found that's recurring is being able to recall information once back in the home environment. Another challenge that older adults spoke about in our research study was understanding diagnosis and medical terminology. And this came up in several of our studies. And they mentioned that, I do have access to a personal health record, but sometimes, I'm not able to understand what it's talking about on the personal health record. Or they get some information from their healthcare provider, and they may get some little slips to kind of explain the information, but it's just not enough to help them understand what's going on with their health. And so this older adult shared that they were recently diagnosed with pulmonary fibrosis. And they said it's been over a year, a little over a year, but I was diagnosed with pulmonary fibrosis. So, the doctor gave me information and stuff, but I was able to get the information online to know where I'm at, giving me more in-depth information that I could read at my leisure. So I like that it's all information is handy online, and you can find support groups and all that type of stuff too. So this is an example of older adults getting some information, whether it be from their healthcare provider or from a personal health record. A lot of the older adults talked about my chart. However, not being able to understand exactly or needing some more information, and therefore turning to online information to kind of bridge that gap. And this brings up a big concern that we see a lot, because older adults did share that they do go online for health information. But one of the biggest challenges of doing that is understanding whether information they find is trustworthy and credible, which is very important to them. So a lot of them said, I go online, but I'm not able to kind of gauge whether it's something I should trust. So what a lot of them would do would end up calling a doctor. And sometimes it would take a bit of time for the doctor's office to get back with them. Or they would just kind of try to wade through it on their own. And so this is a big open issue and a challenge that a lot of older adults, and not just older adults, but other people who use health information online face. But we saw this in our study, that being able to understand whether information is trustworthy or credible, because of course you want to be safe if you are looking for information online. And so this older adult shared with us, but the problem is you don't know if it's the online information is accurate. For example, I can look up symptoms, but I don't know if it's really the same as my health issue. So it's really vague. I would say that you don't know which source is trustworthy compared to the other. So maybe you can just know for sure if it's accurate. So that's another big barrier when looking for or trying to manage health information at home that we saw that a lot of older adults face. And then there's technology skill and usability. So I mentioned my chart as a tool that a lot of older adults had access to. But in one study, we were looking at how can we improve access to personal health records. And we found that a lot of older adults have trouble accessing things like my chart, not just because of some of the technical jargon, but because of usability issues with the system itself, and also limited technology skill. So this older adult was sharing with us that some of the portals are confusing. And a lot of it had to do with kind of the usability of the portal and being designed in a way that's easy for older adults or novice technology users to be able to navigate. So they shared that some of the portals that I have been on have been very confusing. I have to switch back and forth between 2 to 3 different screens. And this is a lot more user-friendly. And they were talking about the technology that we were proposing to them. And then last but not least, I want to talk about access and infrastructural barriers. Again, I work a lot with older adults in the home environment, our community environment, and I work with several older adults who may not have, who may have limited technology skills or access to technology. And so we found through our studies that there are a lot of access and infrastructural barriers with some of the applications that are coming out that are meant to make getting your health information easier. And this is because of lack of internet access in the home, lack of access to a computer, and the older adults that don't have that, they, of course, rely on their library, but then trying to use some of the applications can be difficult for them because they have to travel to the library. So this older adult shared, we were thinking about how we can re-envision technology to support things like lack of access to internet or lack of technology skill. And this older adult shared that I wish these different health apps work without the internet because I let their internet go because my computer messed up. And I was like, oh, well, I'm not going to get another computer. I now ask the kids something and they always Google it or do whatever they do to try to find for me. They will try and find out from different people the symptoms or what they do to cure it, but it's not actually what it is. So they're talking about how they had to let their internet go. They don't want to buy a new computer, but trying to rely on other people to kind of help their kids to help find different information was a challenge for them. So now I want to kind of move into what are we doing in the technology space to try to address these different challenges with access to health information at home. And in particular, I want to talk about emerging AI-enabled technologies. And these are technologies that have AI components that are attempting to make this process of accessing and managing information a bit easier. And so I'll talk about this kind of at a higher level because some of these tools are out there in different forms, but a lot of the research in this area has been looking at, okay, we have these different ways of engaging people with technology. Can we use these different tools to actually make the process a bit better? So just to give some examples of what I mean by AI-enabled technologies, there are several different these kind of commercial technologies that are coming out to actually target kind of consumers opposed to kind of in the clinical setting. Some examples of those are smart tracking and personal informatics tools that collect personal data or collect biometric data to help people manage their health better. There's been some research on smart reminders that help people better remember information or remember things like appointments and medications. There's been some research on companionship applications such as social robots or using things like Alexa to keep people company and helping them manage different parts of their day. My focus has been mostly in personal assistance, including voice assistance. So how can technologies and humans collaborate in order to make this process better? But there's also been some research in monitoring technologies that can be controversial. But I want to talk a bit about what in particular, how these AI-enabled features, how people have been looking at them to help older adults better manage and access their information. So what ways do older adults see that these potential technologies can help them have better access to health information at home. So I'll start by talking a little bit about supporting health management in general. We did a study with older adults where we sat down with them to envision new ways that these AI-enabled tools, and we let them pick whatever AI-enabled tool they wanted, might help them at home to be able to better access and manage their information. And so one of the ways that we found that older adults saw these tools can be useful is just being able to support their health management. They all talked about how it can be challenging to try to, for example, wade through a whole bunch of information on the internet, try to figure out if it's credible or relevant, and even to be able to manage this information that they get from different caregivers, whether that be sharing it with the family caregiver or accessing information from their healthcare provider. And so from this study, what we found is that they were very interested a lot in tools that could help them find relevant consumer health information. Again, once they meet with their doctor, coming home and being able to kind of digest and figure out what different terms mean, what their new diagnosis might mean for them moving forward. They talked about being able to make sense of consumer health information. Again, thinking about the terminology that's being used and how to make it simplified so that they will understand what's going on. And then there was some interest in providing advice and recommendations, which some people have been looking into. We're not quite there yet because it's not necessarily at a point where a lot of these commercial tools can make very trustworthy recommendations, but that was something that older adults were interested in. Facilitating collaborative decisions between their doctors or their family caregivers. And then in emergency situations, being able to contact emergency providers very quickly. We also found that older adults were very interested in tools such as chatbots and Alexa, type systems. I wouldn't say those systems themselves, but those systems that make use of voice or that make use of ways to classify information automatically, to be able to gather information, recall and organize information, but also helping them navigate and interpret and synthesize their information. Of course, one of the recurring themes through all this is safety and security. So that's privacy of their health information, which is very important to older adults. And then also being accurate and transparent about where the information comes from and how different recommendations were derived. Okay. So one of the areas that we look at a lot is looking at voice technologies and things like chatbots that can help people navigate information more easily. And so in one of our studies with older adults, we created a prototype of a chatbot, and chatbots are very popular. So a lot of sites have them now. And a lot of them help you to kind of navigate to information more quickly, just pulling information from the site. So we wanted to see what older adults thought about chatbots in general for healthcare purposes, but also what they thought about chatbots for helping them navigate personal health records, which is a topic that has been of interest for in the healthcare community for helping people get to their information more easily. So we found overall in this study, we showed them kind of this prototype of a chatbot, and we found overall that they felt like these types of tools, if they were in particular voice enabled and also allow for text and chat, they could be tied to a credible source, would be useful for improving access and accessibility. So since they felt like this is something that could go on my phone, so I could potentially access it, for example, if I have to go to the library to use the internet, or if I need to use my mobile data and I don't have internet access at home, compared to my chart, which they felt, yes, I could probably get it up and running on my phone, but because of the screen size, it might be a little bit more challenging to navigate. And the main reasons that they felt like this was advantageous was because they felt like it was very hard to navigate the current personal health records that were out there. And so if we could have something where it could pull the information through by typing in a question or by voicing a question, then that would improve access, but also accessibility for those older adults who might have trouble typing or might have trouble seeing very small font. Now with this, again, comes this challenge of privacy and security of health data. And I'll talk a bit more about that at the end, because that is still an open challenge. Because one of the things they mentioned is like, if we're going to have these types of tools, we would like them to be automatically connected to credible sources. So I won't have to go out and try to figure out, okay, is this information that's being provided to me something that I can trust? And so with that, there's still this open concern about being safe with personal health information, which is understandable, and also being transparent about where information is coming from. So we tested out different ideas for that, as far as connecting them to kind of validated consumer health sources, opposed to things like Wikipedia. And so they were much more comfortable if it was connected to their personal health information record, and also those valid consumer health sources that are well known to be regulated. Another way that AI-enabled tools are being studied to support better access to health information is through aiding understanding. So this is in reference to what we call automatic text simplification tools, which kind of parse different sentences and try to simplify the text. And so there are different ways that we've been looking at this. So in this example that's on the screen is just a prototype tool, and it uses the plain health language dictionary. We digitized it, and then we showed it to older adults to see, would this be helpful in helping you better understand some of those terms that you feel like are using a lot of medical jargon. And so what we found from this study, we showed them, this was specifically looking at medication information. And so what we found with this study is they felt like, again, if we could come up with tools that could help simplify information and classify information so that it wasn't so hard to navigate, that could be something that was really useful for them in being able to at least manage their health information at home. They would still want to be able to contact their doctor or their pharmacist, but this was a way for them to become better informed. And again, this idea of transparency came up because they liked the idea of being able, instead of just replacing the terms in the sentences, to augment those sentences with definitions so that they can understand, what was the original content, but also, what is the simplified content that you're recommending to me. So I would like to end the talk with a discussion of open challenges and opportunities, in particular around automation in health, because there are several open challenges with this. We're still working through how to make this a more safe and equitable approach to supporting older adults' health information access. And in some cases, technology is not always the answer. So some other open challenges and opportunities that me and my team have been looking at is particularly looking at what those concerns are about automation in health. I mentioned throughout the presentation that privacy and security of personal health information is something that's a concern to many older adults. And a lot of these tools, in order to work properly, require access to some type of health information. And so there are some emerging approaches that are looking at how can we make this process more transparent so that people can make really informed decisions. How can we include healthcare providers in the process and other health professionals in the process to make sure that we're following the rules. And so this is something that we are currently exploring because it's a big challenge and it's something that needs to be addressed before we can move forward. Another challenge is with trustworthy and credible results. I mentioned that a lot of older adults are very concerned about where information comes from and how they can go about finding this information. And there has been a lot of research, for example, in public health and in healthcare more generally, on ways that we can help older adults kind of identify trustworthy and credible information online. And so as we move into looking at AI-enabled technologies, this is a concern that we are openly looking at because sometimes the AI does make it a little bit less transparent. One of the things that I've been looking at more specifically is this idea of autonomy and independence. So a lot of these automated tools bring in a different player into the field. So, and there are some concerns about how much automation do we provide someone. And I'll talk about on the next slides that there are some kind of back and forth on what is the right amount of a ton of automation and the right amount of human support. And then last but not least, are we increasing health inequities by introducing these technologies? There are still a lot of folks who don't have technology at home, who don't have internet access at home. So this is a concern I'm continually looking at in my research is how can we make these new technologies and the ones that exist now how we can make this space more equitable for folks who still don't have access to the infrastructure and resources to participate. And so I would like to end with talking about opportunities for human AI collaboration. So I talked about different types of automation. My research deals mostly with kind of how we can collaborate with humans. So not necessarily AI taking over everything, but how AI can support humans in things that they already do. And just some insights from my research and why this is so important is because talking with older adults, technology is welcome, these tools are welcome, but people and relationships really matter in health. People value people, people value relationships, and caregivers are an essential part of this process. So I've been looking at how caregivers can also be integrated into this process of helping older adults find information. And what we're finding is that caregivers also need assistance, especially if they're caring for multiple people, trying to manage that information for those multiple people and also exchanging information between themselves and the older adults. Another big concern is technology can be impersonal, and a lot of older adults I talk to really appreciate being able to go in and talk to somebody and not necessarily talking to something like Alexa. So the questions that we're addressing with these different tools are what are the right amount and type of support when it comes to all these different players that are involved, each of which is important to helping older adults manage their care. So with that, I would like to thank you all for coming and listening to the talk. I would like to thank my many students who, without them, this work would not be possible. And I would also like to thank the people who have supported my research: National Science Foundation, Google, and National Institute of Health, which have provided funding for many of these projects. So thank you so much, and I will open it up for questions.
Oh, great, thank you. If any of our attendees have questions for Dr. Martin Hammond, you can type those into the chat box now or send them through that Q&A icon at the bottom of the screen. We did already have several people ask if you would be willing to share your slides.
Yes, I will. I will send those to you again.
Terrific. Yeah, if you send those to me, I'll make sure that I include them in the email that we send to everybody who's registered for the session with the link for the recording when that's available. And we'll get that out. We did have one person make a comment. They said that in their area, the Philly metro area, about half of Medicare beneficiaries are enrolled in Medicare Advantage, which is a managed care plan. And they're very active in helping subscribers to coordinate their care, access preventive services, et cetera, often through staff like nurse navigators who contact subscribers by phone. So they say that the digital divide isn't an issue.
Okay.
I don't know if you've had any other similar conversations with the older adults that you've worked with or along those lines.
Yes, so I have had a few. Some older adults, compared to others, they do have kind of access to more resources. But kind of my comment about the digital divide comes up a lot with folks who don't have access to those resources or may have some type of limitation on why they don't take advantage of those. But I do know of several of the older adults I work with. They are able to reach out to kind of those types of services, and they sometimes prefer those types of services. So at the end, I talked about how people are important because that's a way, another support tool or another way that they can get access to information without having to kind of navigate that out on their own. So that's great.
We also had another comment that just came in, thanking you for all the work that you're doing in this important area.
Thank you.
I have a couple of questions. Do you have any specific ideas that we can share with older adults about how to ensure that their stakeholders in these discussions or your research or other state decisions that are being made about digital inclusion and digital literacy strategies?
So I think part of some of it is, if I understand your question correctly, you're asking whether there's anything I feel like we can share about, I can share based on my research about how they can get access to different information. Is that correct?
How they can be stakeholders in designing, making sure that their needs are being addressed before decisions are being made.
Yeah, so I think, so I do a lot of kind of like work with older adults. So we call it partnerships in participatory design. And so a lot of times so there's several different things. So one of them is awareness. So sometimes I find that some of the participants I work with or the older adults I work with just aren't aware of what's available to them. So kind of, I don't know if like encouraging them to reach out, but because my approach is typically to go to them. But that might be one way to kind of make older adults more aware of ways they can be stakeholders in their own kind of and make their voices heard before kind of decisions are made. Because I do find that a lot of them do have a voice, but they want people to. It just may be might be an awareness issue. So maybe they don't know who to go to. So one of the places that I work, one of the kind of organizations I work with a lot are senior centers. So that's one way, because at least the senior centers I work with, they do have kind of resources there at the centers for older adults, but just kind of encouraging them to kind of reach out to different folks. And some older adults do that. Like I work with folks who you know, they're not afraid to call someone up and kind of like figure out how to get their problems solved. But there are others that just don't know where to go. I think the library also plays a big role. They talk about that a lot. So they go there for resources, and maybe kind of just looking at ways that they can connect with people in their community to make sure like their voice is being heard, even with their doctor or their nurse. Because yeah, I kind of take the opposite approach of going to them. But maybe them reaching out a bit more, if they aren't already doing that, might be an approach for that, if they know who to go to.
Great, thank you. We have another question. You've mentioned caregivers several times throughout your talk. Have you been able to do any research on caregiving access to online tools or resources?
So we are doing some of that now. One of the studies that that myself and my PhD students we're working with older adults and their caregivers. So it's kind of new. We just finished the first round of interviews, but we have been doing research to better understand what are caregivers' roles. And when I say caregivers, it's mostly informal, unpaid caregivers. So families and friends in this kind of process of finding health information. And just from our preliminary results, we are finding that, of course, the caregivers oftentimes play a huge role in kind of addressing some of the barriers that the older adults face. So I shared how one person would take their daughter with them to the doctor because they had a hearing problem. And so they start taking their daughter because they realize, okay, well, I really want to hear what the doctor is saying. I can't hear it. So can I bring someone along with me? But that brings up other issues as well, because a lot of the caregivers are also taking on kind of additional responsibilities in order, and they're very happy to do it, but they're taking on different responsibilities in order to kind of meet the needs of their family member or their friend. And so, again, it's a challenge there that needs to be addressed from the caregiver standpoint, but they do play an important role a lot of times in kind of helping the older adults get access and to manage the different types of information they have to manage at home.
We had another comment that came in just thanking you for your work and your time sharing today. And then another question is someone is wondering if you'll be doing further research to see if directing seniors to certain authentic sites will encourage them to use more health information.
Yeah, so that's part of the study I mentioned with older adults and caregivers. We are mainly looking at like ways that we can help older adults and their caregivers kind of identify good sites to go to. And that's part of looking at the AI-enabled technologies. For example, the conversational assistant research that we did, we looked at what are validated sources of consumer health information, just, looking at NIH and different sources that are kind of from the government or that are designed for older adults. And we found, early on that older adults really want those validated sources. And so part of the next steps of that research is understanding how to better integrate that and how to help be more transparent about what the site is about. Because some people do, they go to Google and they feel overwhelmed when they see the long list and try to pick through, okay, which one should I listen to? Which one should I not listen to? But that's something we're working on right now.
We have a question on any suggestions you might have for how academic libraries might reach an older adult population.
Yes, I think so. The older adults we talk to are using more public libraries, but I think just having kind of open resources for people to use, because I find it, at least in my research, that older adults tend, or at least the older adults that I work with, tend to rely on sources like the library a lot, not just for internet access, but for getting help with finding health information or getting connected to digital literacy, getting help with like technology and that sort of thing. So kind of my off the top of my head kind of answer would be kind of making lists of resources that older adults might be able to access easily so that they know what they can come to the library for, because sometimes they just want to talk to a person. And so I know that's like putting more work on librarians, but that's kind of one of the suggestions some of the older adults made is like, we visit the library every week. If we can go in and kind of easily figure out, okay, who do I talk to about this or that? And some of them do read like academic papers as well, to try, especially when they're first diagnosed. So in that case, having some type of repository of resources, or at least a list of who do I talk to about what, could be something that's helpful.
And we just had a comment made, and thank you to the person who posted this from NLM and NNLM especially. They said that when they worked at a public library in Pennsylvania, they were trained to refer those seeking reliable health information to consult medlineplus.gov. Reasonable reading level, videos, and Spanish.
Yes, and that was one of the sites we used for our prototype, and people really enjoyed it. So yes.
Good to hear. We have another question here. I know my 70-plus-year-old mom is frustrated because more of her health information has been a pull. She has to get it in my chart versus a push being provided a paper copy in her doctor's office. Has your research seen this type of push-pull frustration?
Yes, definitely. The study we did on personal health records, that's one of the biggest challenges I think that that some of the older adults ran into is that, my chart, there was the technology barrier, right? So if I don't have access to a computer, I don't know how to use a computer, then I can't really access it. But then there was the frustration of, I can access my chart, but then, it's not easy to navigate the information. And a lot of people relied on the paper leaflets. So I definitely see that is a frustration among older adults, because a lot of them really appreciate kind of getting the leaflet once you leave the doctor. And a lot of that is going away now that we have kind of the online personal health record systems. And it can be a barrier for a lot of older adults for different reasons.
We did just have one other comment tied in with that this person is 70, like the mom that was just mentioned, and learned to use My Health Systems portal and really, really like it. Also, a comment was made about the National Institutes of Aging has free publications that can be ordered or downloaded. And let's see. I am going to just share my screen again for a moment so we can get some of the evaluation information back up on there. And let's see. This over with the questions. We've got that link there for the class evaluation. I can also drop that into chat in a moment. And we found it works best if you copy and paste that into your browser rather than directly clicking on the link. The enrollment code that you'll need to enter when obtaining your MLA-CE credit is also shown on the screen. We'll put that in chat too. Many thanks to Dr. Martin Hammond. Thank you so much on the topic and for sharing all your research information with us. And thanks to everybody else for attending today's session. Greatly appreciated. Thanks again and enjoy the rest of your afternoon.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.